Hello everybody. Today I'll talk on general aspects of poisoning in children. Poisoning in children is a common pediatric medical emergency and this involves multi-organs. Starting with definitions, poisoning may be defined as exposure to substance that is toxic in any amount and results in bodily harm. Exposure means ingestion or contact with substance. And toxidrome means characteristic clinical manifestation of specific poisonings. Now come to type of poisoning. It can be acute due to acute exposure, it can be due to chronic exposure. Acute exposure poisoning is occurring with a single contact and lasting for seconds, minutes or hours. Whereas chronic exposure is relating to contact which lasts for many days, months, years, like the environmental poisonings. Examples are arsenic poisoning, lead poisoning. So these occur due to exposure for a long time. The incidences of poisoning is seen maximum in a 2-year-old child, because if you look at the development part, second year is the phase where it is very difficult to control a child, and then these children require constant attention. So if you miss the attention to this child by a little bit also, they are prone to having different accidents. So poisoning is one of them. So second year of life 40%, third year of life 20%, and first year of life 12% is the incidence. The mode of poisoning, 75% is by ingestion, 20% children are requiring urgent management, and out of that just 5% require intensive care, that is care in the ICUs. Now come to different agents which are responsible for poisoning in children. So the chemical agents are all household products. The household cleaning products like bleach, detergents, pesticides, insecticides, paints, naphthalene balls, which is available at home. Cosmetics like hair dye, hair oil, lipstick, powder, shampoos, toothpaste, shaving cream. So these are the common cosmetics used by the family members. So wherever they get this, they can just try ingesting it. And then others are household medications. So medications like analgesics, topical agents, iron, salicylate, acetaminophen, antacids, antibiotics, even anti-epileptic drugs. So any drugs which the adult people or child himself, if they are psychiatric case, if they are taking, so those medications can be responsible for the poisoning for household medicines. And among the fuel, kerosene is one of the commonest fuel that is used for cooking. So this is common, and then paraffin. Now come to outdoor poisoning. Outdoor poisoning can occur with the bites and stings or ingestion. So outdoor bites are bites of animals, insects, snakes, and even in the house lizards, or the spiders. All these can create bite or stings poisonings. And the ingestion in the outdoor plants, seeds like dhatura seeds, and then wild mushroom. Wild mushroom is very life threatening. And then environmental poisonings like lead pencils, candles, chalk, clay, adhesives, pen, ink, all these things children put in the mouth. And then water contamination, example is arsenic poisoning. There are some risk factors. If the child has a risk factors, they are more prone for poisoning. So hyperactive male children are very active, hyperactive. And the less than 5-year children, it is common And then in that also toddlers means 1 to 3 years, out of that 2 years is very common. And large families, if there are large families, they lack supervision. So if the supervision is less to a smaller younger children, and they just are very prone to poisoning. And small accommodation, if the accommodation is small, easy accessibility, the things which are placed are easily accessible, so they are prone for poisoning. Environmental and social factors, developmental delay, mouthing is another important. The children always putting everything in the mouth. Another is pica, mainly occurring in iron deficiency, one of the clinical feature of iron deficiency. So pica, whatever they get, they put in the mouth. And then depression or suicidal ideation children, and mentally retarded children, so they are more prone for poisoning. Now route of poisoning can be by ingestion, that is the most common. Beside that, it can be by inhalation. Examples are gas, vapors, dust, fumes, smoke, spray, all these go by inhalation. And then through skin contact, the pesticides, insecticides. And then through injection, that is bites, stings, and then sometimes drug abuses, drug injections. And then eye contamination is another route of poisoning. Now come to severity of poisoning. It can be of 0 to 3 grade. So grade 0, they have no sign symptom. They just ingest, no sign symptom. Grade 1 comes with the minor symptoms. Symptoms are mild, transient, but they are spontaneously resolving. So just observe these children. Grade 2, moderate. Here there is pronounced or prolonged symptoms. And grade 3 is severe, where there is a life-threatening symptoms. So grade 2 requires intervention, and grade 3 also requires intervention. Now approach, how you are supposed to, what you are supposed to ask, and how you are supposed to examine this child. Approach begins with the initial evaluation and stabilization of the child. So always remember in emergency A, B, C, D, E. So we will discuss in detail when we discuss the treatment of poisoning. Then comes identity or identify the agents. Very important, always identify what this poison is. Then determine the priorities for management. The priorities, whom to call, and then what to do. The indicators of poisoning in case of children are if the child is brought to the emergency room with these features. Suppose a child has a sudden onset of unexplained illness, severe abdominal pain, nausea, vomiting with no any underlying cause, then you might have to suspect poisoning, and then you take a history in detail. CNS signs like sudden seizures, coma, loss of consciousness, and the child is showing bizarre behaviors, then you suspect poisoning. And pediatric patient suddenly comes with the arrhythmia, then also you suspect poisoning. So in the diagnosis, you need to take a detailed history and then do the physical examination. So in the history, very important is where and how. Where was the child found? Whether in the kitchen, store, and how was the child found? Was it unconscious? Was it convulsing? What the child was doing is important. Then details of exposure is important. What was the agent? Always try to take the composition from the parents. Then what time the child had taken this, and volume, how much amount is important. So many times parents cannot tell you the volume, so roughly you can ask, and then by checking the containers, you can also check. Then route of poisoning. Then ask about the immediate clinical effects, what the child did, whether the child vomited, and then whether these symptoms are gradually progressive when the child was from home until hospital or till in the emergency department, how the child was showing the clinical features is important. Then all suspect drugs, herbal products, open bottles, pill containers should be checked. Unusual characteristic odors can be there, so just try to take the smell from the child. Check the substance container always. Recent illness or medications for the patient was prescribed or not, because patient might be taking those. And then any psychiatric history in a child or history of suicidal tendency is important. Examination vital signs is always very important. With the general appearance you need to see. Mucosa and skin are moist or dry, you have to see. Vital signs includes pulse, blood pressure, temperature, respiratory rate, and then the oxygen saturation. And GIT, pain, hematemesis, melena or not, is there or not, that is the general systems you'll see. Or local irritative effects on the oropharynx or GI system should be. Neurological, just examine the pupil, reflexes and postures you have to check. Check the mental status, convulsions, coma, ataxia, paralysis. Detailed CNS examination in the ER room is difficult, so just check these few important points. Then cardiovascular status you check, respiratory status you check. Then plan when to send the child, and then immediately you take some lab blood samples for the lab investigations. So blood glucose should be checked, arterial blood gas analysis should be done, renal function test, liver function test should be done, and then sample for analyzing the poison. So poison, the ingested material should be taken out. And then urine analysis is important. Urine or serum drug screens can be done, and then ECG where required, and radiology X-ray where indicated you should be doing. Thank you. We'll come with the management part in the next class.